Good evening, everybody. It's nice to have all of you here. And we are glad to have this session on the health insurance sector, insurance after COVID. We had another session just a couple of weeks ago on diagnostics and the health sector. And people may ask me why we have brought in one more health company. In fact, we'll be getting one more health company 2 weeks later in Apollo, because COVID is a health issue, and that is a central theme for any economy to flourish and grow. And I will leave it to Himanshu Rai to do the introductions. But before that, a couple of statements. I need to offer my thanks to our radio partner, 92.7 Big FM, and to Money Life magazine, both of which have supported us in making this popular. Thank you very much. Himanshu, over to you.
A very good afternoon to you, all our viewers, and I hope all of you are home, staying safe and taking very good care of yourself and of those around you, especially those who are disadvantaged. And it's a pleasure and an honor that we have with us Mr. Mayank Bathwal, who's the Chief Executive Officer at the Aditya Birla Health Insurance Company Limited, a joint venture between Aditya Birla Group and MMI Holdings of South Africa since August 2015. He also serves as director on the board of directors for Aditya Birla Wellness Private Limited. Mayank has completed more than 25 years with the Aditya Birla Group, and during his stint, he has worked with diverse business units and projects, including fertilizers and copper, smelting units, financial services business, and power projects. Mayank is also the co-chair of FICCI Health Insurance Committee and a fellow member of the Institute of Chartered Accountants of India, ICAI, and the Institute of Cost and Works Accountants of India, ICWA, and the Institute of Company Secretaries of India, ICSI. Mayank was recently awarded the prestigious Aditya Birla Group Award 2020 for being an outstanding leader by Mr. Kumar Mangalam Birla. So Mayank, a very warm welcome to you. And before Bhaskar and I start bombarding you with questions, we would request you to talk a little bit about health insurance in India, because many of our viewers may not understand the subtler nuances of health insurance, and then take us through how and what impact has COVID-19 had on health insurance. Over to you, Mayank.
Thanks, Himanshu, and thanks, Bhaskar. As Bhaskar mentioned, I mean, health, is, to my mind, one of the key pillars of the, for the growth of any economy. And health insurance industry, in that sense, is a very important part of the overall health ecosystem, because it plays a very important role of funding of healthcare, or rather one of the funders of healthcare costs that Indian citizens spend. Now, the sector opened up in 1986, so the last 33 years, a lot has happened. After the formal opening up of to private sector in 2000, it was felt that maybe we need to create a separate category, of health insurance, and therefore a new category called standalone health insurers came up around 2006-07. And since then, about 6 players have come in. We are the last one to kind of start business. Now, health insurance, if you look at it, the penetration is very low, because still about 65-70% of Indian consumers spend their healthcare costs out of pocket. There's some element of government funding. Indian government started the largest healthcare funding scheme in the world, Ayushman Bharat scheme, which actually covers about 55 crore of Indians. And other than that, it's all everyone on their own to get insurance. So just about 4 odd crore people have bought their individual health insurance. So if you think about it, out of the balance, about 80 crore Indians, just about 4 crore individual. And even if you take roughly two per cover, 2 members of family per cover, just 8 crore. And then there's about 10 crore cover through, corporate covers. So there's a very large percentage of people who are not covered. Now in that, so clearly, no wonder that it has grown as one of the fastest growing categories of insurance, about 25% or so every year, with the Sahis players growing at about 35 to 40%. Now, COVID, when COVID happened, 2.5 months back, the relevance of health insurance became so much more apparent to all of us, right? Suddenly we started realizing that this unfortunate virus can impact anyone, not just in India but across the globe. And the cost of treatment sometimes can be pretty high. It can go up to about 10-15 lakh, if you're getting treated in a private facility. And therefore not having the ability to fund it can become a big burden on in Indian consumers. So therefore the relevance is very, very high. Now, for a health insurance company in these times, two, three things have become very important. One is that, make sure that we are there for our customers, available to them, especially because claims can still happen irrespective of whether the companies are working from home or not. And therefore, how do you make sure that your processes, your technology is fully enabled to serve consumers fully? And in fact, even better than any other time, be even more empathetic with consumers, because this is a very stressful time indeed. But I must say the sector has responded extremely well. We and as well as all our peer organizations are fully enabled to support consumers. We guided by a regulator and also many government guidelines. We have made sure that we've made suitable adjustments, changes in our processes and procedures to be able to serve customers and also our healthcare provider partners in these very tough times. A lot of opportunities, I also must say, have emerged in times ahead, Himanshu and Bhaskar. I mean, one, and to my viewers, one is that as the opportunity increases, because people are there's a heightened level of awareness, COVID driven, Ayushman Bharat driven, and also the entire industry is also going through a whole awareness program called Fayde Ki Baat. So all of these are increasing awareness, and therefore how does the industry respond to the increased stimuli or the trigger in consumers' mind? How do we reach out not just through the traditional models of distribution, but how do we create newer models? And especially given the fact that whilst health insurance has typically been a face-to-face selling model, your next door agent will typically reach out, come to you, fix an appointment, sit and sell. That's no longer possible now for the foreseeable future, right? Because this virus is still here to stay, and people will not feel very comfortable having these interactions face to face. So how do you digitally enable your traditional sales channel? How do you digitally create new digital opportunities across not just your traditional prospect, I would say, platforms, but also create new platforms where you can reach out to consumers? So that's become a big opportunity. So therefore, are your products ready for those new segment of customers who will be looking at that? Are your products ready for new platforms of distribution? So those now then become very relevant. And thirdly, that will you be able to provide that comfort and assurance to the customers that irrespective of what happens, whether lockdown stays or comes back in different avatars, and this whole social distancing norm stay, will you be able to serve me in the way that I expect you to be? Will you be able to respond to my needs in the way that I expect you to? I think all of those are imperatives, as I would say, opportunities for the category to actually create much better category advocacy with their customers, and therefore individually for each of the brands. For example, we know that typically there have been cases where customers have felt that has the category really been able to pay out claims as efficiently as it should have. So these are times when we can actually go out of the way to create a much better experience. Plus we create uh, other modes of engagement with the category. So because if health today, if you do a research, you'll find that all surveys have shown that health is the number one topic on the mind of every consumer today, right?
Absolutely.
And not just their own well-being, by the way, it is well-being of the general public also, that they are, each one of us is also concerned what's happening to the other person whom we even may not know. So in that context, the health insurance in industry has a huge opportunity to reach out and go out of the way and create connects for reasons other than just transacting for the health insurance product. So for example, we did a program called Health at Home, where we got experts to talk to our consumers, Facebook Live, across different dimensions: mental health, nutritional health, physical health, and so on and so forth, for senior citizens, millennials, regular consumers, children, and just talk to them, address their questions, give them advice. and that's gone a big way in improving the trust that the category can create with its consumers. So I would say that these are very unprecedented times, but because this is a health driven crisis, I think the opportunity for everyone who is part of the health and healthcare ecosystem to actually look at I would say, not for I wouldn't say that we should I like to see an opportunity in these tough times, but it's an opportunity to actually provide that protection that every Indian needs, and reach out, and it's something that every one of us needs, right? No Indian can say that they don't need health insurance. So how do we leverage that opportunity, but also expand the role of the category to what I have always believed in health insurance? Health comes first, insurance comes second. So if we do not play a role of a health partner, then we are not actually doing justice to the opportunity that is there for health insurance as industry. And I think COVID time make it even more imperative, because every Indian consumer needs support on health. And I'm very happy that the government of India has brought out guidelines around areas like telemedicine, e-pharmacy, and there's more to come on digital health. I'm very, very sure. Whilst many guidelines on digital health that come, but I think I'm very confident that in times ahead, guidelines around health data, how do you better integrate with the hospital ecosystem, all of those will become norms. And I think that will create a much more, I would say, efficient overall health care ecosystem, which will be good for all the three elements of the 3P triage, as I say: the patient, the provider, and the payer. And that's where the future lies. And I think each one of us will have to play a role in making this more and more efficient. And I'm very excited about the opportunity ahead, even in these very tough and unprecedented times, because optimism is the only way to go forward. Fear will not take us anywhere else. So that's what I had to share. I'll be more than happy to take your questions and to the best of my ability. Thank you, Himanshu and Bhaskar.
Himanshu, over to you.
So that was wonderful, Mayank, the way you have explained the subtler nuances of the health insurance industry as well, apart from the health insurance itself. Now, my first question is out of sheer curiosity, Mayank. Now, most companies have health insurance as divisions of their insurance companies. But with you, health insurance is a standalone company. Why? I mean, how did this happen?
Yeah, health insurance is not another product line, Himanshu. Health insurance is a business, because health insurance is not just about product, customer, and distribution. You have another very important element in this whole, I would say, jigsaw puzzle, and which is the provider side, the whole healthcare ecosystem. And to make sure that, because ultimately the service is provided to the consumer at the healthcare ecosystem, not directly by the health insurance company. We play a role in making sure that service can be more efficiently delivered, right? We can influence that, but we don't provide that service, right? So the whole business of making sure that this whole ecosystem works very efficiently is very different from just adding another product to, let's say, another line of business, as typically what was earlier, till a standalone health insurance category was created. And that is evident in the way us, and along with all our peer SAHI companies, have actually demonstrated the fact that we have outgrown all of the other lines of business, the other providers, because our whole focus, I mean, for us, it's only line of business. And the fact that today the penetration is just about 5-6%, it's the whole, there's a big white space. And therefore we felt that to make sure that we efficiently run it, claims management, I mean, unlike, let's say, life insurance, where claims will come once in a while, here claim can come next day. You sell a policy and next day an accident can happen, unfortunately, right? An hospitalization can happen anytime, right? I mean, so the whole system has to be geared up for a very different kind of operations, and therefore it's very important that a separate focus is given, and clearly all players are recognizing that.
Right. So you just mentioned that 8 to 9% is the penetration so far as our country is concerned. Now, even if I compare it with similar countries, with comparable countries, I'm not even going to compare it with developed countries. This is severe under penetration so far as India is concerned. So what do you think the government should do, and what do you think you can do to make it more popular and attractive? to increase this penetration?
Yeah, very important. Because as I said, it's relevant for everyone, right? I mean, rich or poor, a newborn child to the senior most citizen in the country, any part of the geography, everyone needs it, right? And so the question is, why haven't we taken it? Somehow, I think this whole belief of karma in India, right? We believe that do your job and things will happen,
He will
and the
take
whole
care.
the whole culture of risk management is typically not there, because we believe that if we pay something, I must get back something immediately. And I always ask this question to consumers, that you are okay to buy an insurance for your car, but not for your own life or for your health. It's not, why do you expect a return immediately, right? I mean, it's there to protect you from insurance is all about the probability of something happening and being protected against it. Now, how do we deal with it? I think the government of India has done its bit by coming up with I would say, a very, very unprecedented, it was really a huge scheme to launch Ayushman Bharat, fully funded by the government, cover about 50-55 crore, and most of the many governments have, state governments have actually enhanced the coverage to even beyond the originally intended population. So it might go to closer to 60-65 crore of people. A regulator has brought out a very standard product called Arogya Sanjeevani, which to my mind should actually cover about next 30, 40, 50 crore of people, India's population, because that's a very standard product. So people who are buying insurance for the first time, or people who have an affordability as an issue, or don't understand insurance so well, I think it's a great product for them. So that might take up to closer to about 90, 100 crores. And the next 30, 40 crore people who can pay for themselves, and can afford it, I think for them, the other regular forms of insurance is available. The council industry got together, and we decided that we must create a much larger awareness program for insurance, health, general insurance, where three lines of businesses: health insurance, home insurance, and motor insurance were part of that in the first phase. We started that program sometime back. Health has been one of its core focus. Unfortunately, COVID has come, but actually, by just by chance, it is more it is more imperative now that you buy health insurance. So that will also play its role, and that's not going. Hopefully, that's not going to be a one-time event. It's going to be an ongoing. And then individually, all of us also have a role to play to promote health insurance, right? And I can only say that for the unfortunate reason, but finally, I do hope that COVID acts as a trigger for people to believe that we must buy insurance, because it's not a big cost to pay. 10,000-15,000 rupees is not too much for each one of us to get that sense of relief, a sense of comfort that I'm protected, my family is protected, because you don't want to lose your savings because of unfortunate event. So I think a lot of things have happened in the last 1 year, Himanshu, and my sense is that a much larger part of the Indian population will start getting covered now. But I must say that our job is just begun, and we have to travel a long distance, and we must play. Each one of us will have to play our role in making sure that every Indian customer realizes that they must have protection for their health.
No, it's very interesting, Mayank, that you mentioned the entire fact that people by and large in India believe in karma, and which is why you possibly have more people wearing the helmets on their hand rather than on their head, where it actually should be, and then hoping that everything is going to be hunky-dory. And very recently, I know that when we made the norms of the Motor Vehicle Act very, very stringent, most of the states refused to adopt them. And that was very unfortunate. But I think you're right that perhaps COVID-19 that ways is going to be some kind of, it may have a signal effect on people at large, that it is very important to take care of your own health. And I hope, fingers crossed, Mayank, that that behavioral change actually comes around. Now, you mentioned Ayushman Bharat, and this obviously has expanded the basket so far as health insurance is concerned. But do you think we have enough doctors? Because if we look at the number of medical seats that have increased, they haven't really increased proportionately, have they now?
Yeah, that is a big problem, and I think because the supply side has to in some way meet the demand side as well. So I think there is a role of the government and role of the private sector both. And the role of the government in terms of there's a role that government will have to play in public health, because there's an issue of affordability, and for a certain category of the Indian population that will have to be provided. Maybe I think if I hear and our Prime Minister talk about the focus on healthcare going forward, I'm hopeful that there will be big shifts in times ahead, in terms of not just the size of the healthcare ecosystem on the public health, but also the quality of that. And the private sector, I think there has been an increase, but I think there's a lot to be done. See, there are two ways to solve the problem, right? One way to solve the problem is to of course, get more doctors, more nurses, more hospitals, more beds, and so on and so forth. The other thing is that when should intervention happen at what stage, right? So if there are hospitalization events happening, uh, what can we do to avoid that event? Is enough happening? How many Indians actually doing enough for their health, right? And there also this whole thing of oh, I want to so in the number of people who would put I want to take care of my health as a new resolution, and the number of them who forget by 7th of January, we all know about that, right? So I think the way to solve that are two. I think there has to be a big a focus on preventive and primary care. And one of the key components of Ayushman Bharat is also the health and wellness centers. And now that I have been in the category for some time, I see so many customers. Even if you provide, for example, a free health checkup, they'll say, no, I don't want to go for that, because what if something comes out? There again the whole karma thing comes up. I mean, isn't it better that you know what the problem is, rather than sometimes we feel that, like an ostrich, if we put our head into the sand, nothing will happen around us, right? So I think, so that's one piece. Focus on primary and that care, and see the whole issue on how do you go to a GP first before you go to so you don't necessarily need more specialists. Maybe you need more general physicians, and the focus has to be there. The second is digital health. I think the whole, and I think I'm extremely excited about this whole, possibility that can happen through telemedicine. See, people in any part of the country through telemedicine can get access to the best quality doctors. And by the way, let me also tell you, Himanshu, that because I get an opportunity to meet with many doctors, it's strange that whilst we have, on one hand, we say that we have got less doctors. On the other hand, there are many doctors who are not able to, earn enough even after passing, because there'll be a big difference between, doctors who are doing extremely well and doctors
the popular doctors and the not so popular doctors.
Yeah. So the point is that there is a lot of capacity available in our system, to provide, it's just that sometimes, how do we make the demand and supply meet? And some of that can happen through digital health, because digital does one thing. It creates an ability to provide a facility at scale, and wherever it is required, by whoever it is required. It democratizes the availability of a service, right? And I think that's what I feel is one element. I'm not saying that's the only way to solve the problem. We will still have to do more. I think many more institutions are being set up, more AMC are being set up, more medical facilities are being set up. And I think, again, the government of India has spoken about it, that they are focusing on this at scale. So while that is happening, I think there are some other form of smart service provisions also, which will help. So it's a combination of these, which I think hopefully will do. But I think the COVID crisis has clearly spelled out the need to focus on health. We can no longer afford to just have just 1% of India's GDP being spent on health at all.
Miserable.
Right. So, it's very interesting that you mentioned this about the telemedicine and telehealth, in fact, doctors being available online, because again, there are two sides to this story. One, given the pandemic, I think less people would want to go to the hospital if they had a choice, and therefore go for a zero contact kind of thing, because half the people are afraid that if they go to a hospital, they might bring back some other virus, if not the COVID-19. And therefore, to those people, it would make a lot of sense if it is online. And as you say, you can reach the masses. On the other hand, For instance, when banking went online, there was a large population of India who was still not very comfortable in talking to a machine or in doing some things on a machine. Even my parents, for example, they've never bought a credit card. They've never got a credit card for themselves, and they hardly ever, if ever, do any online transaction because they always find it far more convenient to talk to somebody where money is concerned. And likewise, I think there would be a certain set of people who like to talk to doctors face to face, being physically there, being, their nubs being checked, etc., etc. So I think this is a very interesting kind of a dilemma, which post-COVID might see some kind of change with people moving from one side to the other. What's your take on this, man? The other side?
Yeah, see, let me share this, Himanshu. I don't think so. The face-to-face interaction can be substituted,
Right.
by telemedicine. What telemedicine is doing is, in a way, gatekeeping, right? I mean, there are stuff that can happen on telehealth, telemedicine, which can then lead to the person having to go to meet a doctor, or what kind of a doctor, when, where, all of those can be guided, right? That's what becomes. I'm saying, forget about, like today, we have a fear of going to a hospital or of meeting a face-to-face, having a face-to-face interaction with a doctor. Let's say COVID is gone, everything is okay. Even in that situation, telemedicine has a role to play, because see, today, I'm sure many times we face the situation that we have a small question, and we are wondering, if there's a possibility of calling up a doctor and just seeking that, and if you know the doctor and just seeking that advice, rather than going all the way to the hospital or to the clinic. There are many times we face that situation. Now, when we were, at least I remember when I was growing up, there used to be a concept called a family physician.
Yes.
We have all forgotten about the concept of family physician. Family physician,
The GP.
whole concept was GP, and there's a gatekeeping. That
Yes.
before you go to a specialist, the regular stuff can be done by the family physician, right? That
Absolutely.
concept has gone away. So now we straight away go to the OPD department of a big hospital, straight away to specialist. I wonder whether that's the right thing. To my mind, telemedicine is another category of what I call gatekeeping, before you actually go and meet up.
Go to a specialist.
Second advantage of telemedicine is, and by the way, telemedicine is not only about talking to a machine, right? You're talking to a face, and on video call, you can actually talk to the doctor face to face. So you're seeing, it's just that you're not present physically. And this person living in rural area, person living in tier 2, tier 3 town, I mean, a lot of time they have to rush to meeting up, going to the big towns. If this facility is available and people start using it, you can get the advice of some of the best doctors sitting wherever they are, right? In within the country, internationally, for that person, so that the initial advice is given before you decide that whom do I go to the next round. So I think it's not either or, it's and it is all about amplifying the ability to provide the right kind of services to the Indian population. And especially, please understand, in India, the fact that our size of population is so big, we will have to look at all of these alternate options as well.
In fact,
Absolutely.
COVID-19 has accelerated telemedicine. I know all GPs in Bombay, whom I know personally, have all opted for telemedicine, partly because of fear and partly because of convenience.
Absolutely.
Great.
And
great.
partly because of compulsion.
Partly because of compulsion.
Compulsion, yes, absolutely. It's like fear. Fear was a major factor. GPs don't want to deal with patients face to face.
Yeah.
Okay. The questions that started pouring in, Mayank. One of the questions that comes up is, when you, as an insurance company, have to deal with claims, do you have a TPA in the middle? Because the TPA is the most hated person in the sector.
I think that's before I get to my on behalf of my TPA fraternity, I think it's a little unfair that we grant them generally in like that. We deal with very good quality TPAs also. Having said that, for all our retail portfolio and wherever we can in the corporate portfolio also, we have completely in-house claims management. In-house claims management.
Okay.
And only where, in case of corporate policies, where the corporate wants a particular TPA to serve their claim, administer the claims, do we go through the TPA route. Otherwise, we prefer doing that, not because of anything else, but because we believe that claims is a moment of truth, and we would rather handhold the customer ourselves than outsource that whole process. And that's what we have done from the day one of our operations.
Okay. The other question is that in insurance, prevention of an illness is better than cure of an illness. It's cheaper, both for the customer, both for the patient, as well as for the company. How do you go about preventing an ailment from taking place?
Vasudha, it's a very, very important point. Okay. Unfortunately, the focus of healthcare generally and health insurance in particular has been more on sickness funding, sickness insurance. Correct. I think we need to move towards health insurance, wellness insurance, right? And wellness, and that's what I mentioned to Himanshu's question, that preventive primary care has to happen before you get to a secondary and tertiary care. Now, that is, one can say, conceptual. How do you make it work? Correct. Now, when we started our business, our whole focus has been health first. Okay. So therefore, for example, for all the customers, India's population, 65% of India's population below the age of 35. Because it was all sickness insurance, they did not feel that there is anything, they will fall sick, and so that's why they should buy insurance. We said, don't worry, we will pay you 30% of your premium back if you take care of your health. And suddenly it became relevant, right? Because now the consumer says, oh, if I take care of my health, I get 30% of my money back every year. And if something unfortunate happens, I am still fully protected. So suddenly it becomes relevant. In our case, we provide a free health assessment to all our customers, even after buying the policy. 46% of our customers use that facility. Industry average, 4 or 5%. Now, what does it mean? That 46% of our retail customers actually know something about their health. Will they do something about it? Possibly yes, because they now at least know that they are at risk of this. Or I'm not saying 100% of them will do something about it, but even if 5, 10, 15, 20%, and as we start getting an ability to engage with them more efficiently, we're able to influence them, more and more people will hopefully start doing something about it, and we can act like a trigger for that, right? Now, that's what I call preventive, because the first thing is that you need to know your health before you do anything else. Correct. Everyone has a condition, to my mind. My condition may be that I have a good health condition. For someone else, it may be a sickness condition, right? But we need to know what is my current health condition, and then only you can do something about it. So I think that's the first thing. And I think the other, of course, we all see, at least in the younger population, a slightly larger awareness around the whole notion of health. I just hope that, and maybe it's more to look good than to stay fit, but so be it. Even if it is to look good, at least you're doing something about it.
At least they're doing something, yes.
Please continue to do that. So that's what I would say. But I think the whole model of both the healthcare delivery and the health insurance has to move to more and more wellness-driven health insurance rather than sickness-driven health, insurance.
Excellent. Okay. Now there are some questions directly connected to COVID.
Yes.
Typically in the insurance business, when you have a pre-existing ailment, your premiums go up. I've had COVID, I've recovered. Is it pre-existing or is it over? Point one. Point two, the age of pandemics has just begun, as almost epidemiologists will tell you, that we're going to have more recurrent phases of infections, climate change, lifestyles, etc., etc. How do you deal with it, with this uncertainty in your business?
Yeah, it's an important question, both from a consumer and our perspective. The first is that your first question was about if you have a COVID and therefore COVID is not a pre-existing disease. Let's understand.
Okay.
It's like any other infection. Like it's like the common cold.
Cold. Okay.
Just because I've had a COVID condition doesn't. When we talk of pre-existing disease, we are talking of a disease which has, the possibility. Like if I have, for example, diabetes. Now, diabetes, unfortunately,
is a pre-existing.
There's no cure. You can manage diabetes and live a very healthy life, but there is a condition that I have, and it's there to stay. It can come back the moment you again lose the management of part of it. So COVID is just a an infection event which has happened. Just because I've had COVID doesn't mean that I have a disease which is there to bother me in the future. So no, COVID will not be treated as a PED in insurance. That's one. Second, the very important point that you made, whilst I'll hope that this is also 1 in 100 year event, and the next COVID will only, or whatever avatar will happen only after 100 years or more. But the fact is that we are at higher risk of these possibilities than at any other time because of various reasons, and that itself is a topic of discussion. So I don't want to get into details on that.
Yes, you've had SARS, you've had Ebola, you've got H1N1, you've got COVID. The frequency, every one of them, the frequency is increasing.
Correct.
Contagion is increasing.
Yeah. So from a business, from a consumer perspective, of course, it means that you have to be more careful, focus on your health, create more immunity. Don't wait for an event to happen. From a business perspective like ours, I think what means that our risk management practices have to actually get to the next level. So, for example, in India, pandemic reinsurance is not very, very popular.
Yes.
And now there will definitely be a heightened need to bring that. The reinsurance companies will have an opportunity to bring that offering now more and more, and each of the individual insurance companies will like to explore a pandemic reinsurance more than at any other point of time. So I think plus there are many other aspects of dealing with a pandemic like this in terms of not just risk management but also operational continuity. So that will have change. Pandemic. When did we ever think that all of us will have to work from home, right?
I know.
You will. I mean, education will happen remotely online. I mean, if anyone was to say online, education, I'm sure Himanshu would agree that one would say, no, what's the, how can it happen at this scale? But it is a reality, right? My son, who studies in US right now, is back here fortunately, and he's doing online courses. So globally, sitting in India doing courses, for his college. So I think lots of stuff is going to change, and businesses are going to, because of a pandemic. And I think there are many other implications other than just the pure health related, I would say implications that businesses will have to deal with, including consumer preferences, consumers' style, and so on and so forth. So I think there's a lot.
Do your policies that currently include COVID treatment?
Absolutely. All are.
They do.
Yes.
But will there be a change in policies given the chance or the likelihood of there being more pandemics?
No, I think to my mind, the shift in the trend is more towards more inclusion than exclusion. Okay. So if at all, my sense is, and I do hope that, as an industry, because it's very difficult for one or two players to do that, otherwise they'll be outpriced. I think for the industry, it is important that we become, we have less and less exclusions and more inclusions, so that the product becomes more and more relevant for consumers.
Exactly. Two more questions. One, is Ayush covered by insurance companies? That's one question. And another question that's come from the audience is, to increase the penetration of medical insurance, why does the government make it statutory, compulsory? Like so many other schemes that have come in. Your base becomes larger. With the younger population, your risk becomes lower.
Yeah. So Ayush, to your first question, yes, Ayush is, I think most of the products have Ayush in some form or the other.
Okay.
Some have in form of a certain amount of coverage. Some have virtually, equal coverage like allopathic. I think on the Ayush side, what is required for insurance companies to provide even better coverage is more data and more structured data on where the service is, what's the cost. I think those are some aspects that there is a challenge for us in terms of pricing. But I think now we cover Ayush to a very, very large extent.
Brilliant.
And your second question was, sorry, you said.
The second question is, why doesn't insurance become compulsory?
We would love to do it for that.
You've done it for vehicles. The government has done it for vehicles. Why not for human beings?
Yeah, I mean, that's what we sometimes say, that if is life less important, is individual's health less important than car.
Absolutely.
So I wish that can happen. I think I'm not saying that just because as a provider we'll get an opportunity to present.
No, it makes.
I think it takes away, that element of risk from the consumer's life, which is very
Correct.
important. We can enjoy, a life only if we are healthy. And, so whilst I want to take care of my health, but I also must have assurance that if something still happens, I don't have to dig into my life saving to take care. Because one thing is very clear, rich or poor, everyone wants the best quality healthcare.
You bet.
So, and if best quality healthcare will come at a certain cost, so then you must be protected against it in terms of transfer of risk.
Okay.
Just as an extension to Bhaskar's question, Mayank, do you think it's time for India to have advocacy groups attached to the industry? So would you want an advocacy group which would do advocacy on your behalf to the government of India, saying that you must make it compulsory?
See, I mean, to that extent, I mean, there's a council of the industry, there's a regulator, so, whichever form you say, I mean, the council, of course, if there are others group who support that, good for us. But I think the best form of advocacy will finally happen through consumer experiences. And there's nothing better than that. So if consumers, if as a category, we start becoming more and more relevant for consumers, and provide that the kind of experience that consumers expect of us, then to my mind there's nothing more powerful than that advocacy.
No, my only argument is that just like pensions, just like ESIC, insurance, a lot of it is driven by government policy. If the government had the right policies in place, and this is where advocacy comes in, if the government puts the right policy in place, it expands the base. If it expands the base, premiums fall because India has a young population and the risk is spread across.
No, absolutely. I mean, the other day, I was asked this question that why is the premium for senior citizens, for example, more than sometimes what they feel they can afford? And the simple reason is, please understand, if we are 65% of India's population is below age of 35. And a big part of that population does not buy insurance.
Which is sad.
Insurance is a game of subsidy by the young and healthy for the and the not so healthy, right? Every young and healthy person has to remember that at some stage of life they will also be at an age where they will have a health condition and may find it difficult to afford. And that's all insurance is all about. That's how it started, right?
Exactly.
The village people got together and created a pool of fund that whoever needs it will use this. That's what is insurance. And therefore, the more people coming in, as you very rightly said, the larger the opportunity to create more, I would say, expansive coverage. And also the premium size will automatically reduce.
Yes.
So because you're now getting more and more younger and healthy consumers. And I'm happy that we started that process, because some of the product that I mentioned, the offering that where we incentivize, we find that from whatever data, it's not fully formally shared, but whatever we understand, our average age of consumers is about 5 years younger than industry. Now that's not because we are not covering the senior people, it's because we are covering more younger and healthier. But we need more players to do that,
yes.
And we need larger advocacy for the young and healthy Indians, that you need health insurance.
Right. So my last question to you, Mayank, and this comes from something that I see here sitting at IIM Indore or in other educational institutions. I think one of the areas that has been underserved and even overlooked by a lot of people is mental health. Yeah. So even when we look at health insurance, there are the pathological aspects which are covered under health insurance, but there are so many aspects which are actually not covered. Do you think that, and especially now when people have been in lockdown for a long time, despite the fact that I don't have students here, still my counselors are on the phone all the time. I mean, that is the extent to which people feel this need to talk to somebody. And more so after COVID, I think that human interaction, the need for that human interaction is going to increase multifold. Do you think it's also going to change the way you as a health insurance organization would want to look at it?
It's a very important point that you're raising, Himanshu, because and unfortunately there's this the moment we talk of mental health, there suddenly a stigma gets attached to it.
Yes.
Mental health is not about what we in our we used to understand that mental health means someone mental asylum. That's not mental health is that all of us at different points of our time, you and me, all of us have gone through moments of stress where without our realizing we are actually in that state of depression, and we need some expert counseling support, right? Now in some cases it is required at a in a real professional manner than some of the others, right? Now the and from as a health insurance company, given the fact that there is a lifetime guaranteed renewability commitment that the consumer has, because of that's the way regulations are, and I think which is a great I would say a positive for any Indian consumer. It becomes even more important that anything that we can do to reduce the possibility of a future health event happening is actually going to help us, and that's where many of the future events happen, because somewhere it has started with the mental health condition. Now how do we intervene at the right stage? So there are two parts of it. One is a big part of mental health is actually what I call out of hospital, right? The regular, I mean, it's a outpatient coverage. Second is that how do you get Indian consumers to actually use that, and how do that facility? So I have personally, and you've touched something which is very close to my heart, because I have actually personally done a lot of personal research on this area. I've spoken to a lot of people around this. We have an entity called Empower, which is run by Mrs. Aditya Birla, which is actually focused on entirely mental health, and I get an opportunity to interact with her, and I've spoken to her, and we have interacted a lot with her team. We do a lot of stuff with them on the corporate side. So one is that today, unfortunately, outpatient coverages are not there in the most of the products, and there, how do we do that? I'm very keen to provide that. There are some hurdles in that. It's a big discussion point. So we are trying to see how we can solve that so that we can offer more and more of these facilities. The other thing is that we're looking at provision of these services through three means. The face-to-face interaction that typically happens is something that many people don't like to do. Many people hesitate in going to a mental psychiatrist or a counselor, right? The other way to do that in today's world is to have a telephone or a video-driven conversations. Telephone sometimes works because you can in some way manage your identity much better. But also we are now also exploring the possibility of mental health services being provided through digital
online counseling.
So we are trying to talk to. We are in fact on our Active Health app. There is a facility of mental health. So we have tied up with a expert provider on that, which who has expertise, and all our customers have access to mental health support through our Active Health app. So we provide that, and we don't charge our customers for that. So we are seeing who's the what is the best way to provide that support, including some of the discussion that we're doing with Empower on these rounds. And I would love to have so some of our newer products, whilst there is now a directive by the government through a court decision, and also by the regulator, that you must have mental health in all our products. But the fact is that's not really the way it should be. I would want people to use that facility, right? Absolutely. So what we are now saying is that we provide that facility, whether you use digitally or a telephone, and please use it, because in my mind this investment will go a long way in
improving physical
deferring or hopefully stopping a future health event. And so for that, the infrastructure has to become more amenable for the insurance companies to provide that facility. But I do hope that in fact, by the way, under the Health from Home event, we did a lot of mental health programs for our customers, and it was open for public because it was on Facebook Live, where we got some mental health experts to just talk to consumers, take their questions on what are they going through, what do you do, including people from Empower, some of the experts from Empower who did that for our employees, for our customers, for our prospects. So you're right, Himanshu. I wish it becomes more prevalent in India, and we accept that as a normal way of being, rather than the stigma that is attached to it.
Thanks. Absolutely. Anyway, thank you, Mayank. Thank you very much for being here. All good things, unfortunately, have a time expiry set down right at the beginning. Thank you, my audience, for being here. Just to remind you that next week we are going to have someone very interesting We're going to have Niranjan Hiranandani from Narejco. He's also the president of ASSOCHAM, who's going to be talking with the construction industry. Then we come back to health. And then we have a surprise for you the week after that. And thank you once again, Mr. Mayank Bathwal, for being with us, for helping us through this complicated maze called health insurance. Thank you. Mayank, over to you. Sorry, Himanshu, over to you.
That's okay. So Mayank, thank you very much. It was indeed a pleasure listening to you. And these thoughts were so refreshing that being from a health insurance industry, you lay more emphasis on health. And your message to all our viewers was that you should try and be active and be healthy. And I think this is what even I would like to talk to all my viewers. My message to all our viewers is also this, that please remember, swasth sharir mein hi swasth mastish ka vaas ho sakta hai. A healthy mind can reside only in a healthy body. So do take care of your health. Mayank, thank you very much once again. Bhaskar da, it was a pleasure once again hosting it with you. And to all our viewers, please stay home, take very good care of your health, just like Mayank advised us, and that of your family around you. Thank you very much.